So thank you all for I checked my phone. Thank you for letting me know that you're not hearing anything. I'm not sure why. We'll fix that in a few moments, but we'll go ahead and go to the practice exam. So I apologize for that. I'm not sure why you weren't hearing anything, but we'll just bypass that. It was the introduction to the course. So just letting us know, if you'll please let us know where you're located. If you're in a different country, we'd love to know that. If you're in the United States, we'd love to know that. And maybe the reason why you want to become a CNA. What is your goal? My goal for you is to go beyond CNA. So I kind of trick you all. I have you all sign up for these CNA courses and watch all these videos, but I'm continuously just planting seeds that hopefully you're going to become the next nurses, the next nurse educator. So Janelle is taking her exam in New York. Victoria is Washington, Seattle. Very good. Josie's Pennsylvania. So we're talking about all over the world. And I know usually my students who are from other countries, they'll log in the evening time. So I appreciate you all for watching. I'm glad you can hear me now. I'm going to go back to this and we're going to start our first practice test. I will be monitoring the chats from my phone because I can't do so when I'm sharing my screen. Florence is in Florida, Blossom Mary's Connecticut, and then the Miller fam is in Illinois. All right, so here we go. Welcome to Nurse Eunice's online CNA exam prep course, where we're dedicated to helping you succeed in your certified nursing assistant journey. In this section, we've compiled a comprehensive collection of practice questions to assist you in preparing for your upcoming CNA examination. Blah, 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 blah. Best of luck on your CNA journey. Let's dive in and start mastering these practice questions together. And so we're not going to do all 100 questions, but we're going to practice a few. And I took this test before and I only answered one question and I failed. So if you do not get a passing score, great to know is that you can reattempt the exam. And for this one, I only allowed you to retake it twice because this is a cumulative exam. So you wouldn't want to do those practice tests at the very bottom, the ones that's in our test bank, until you've taken the embedded tests that go along with every other skill. So if, for example, basic nursing skills, personal care skills, mental health, our CNA skills. It also includes the videos. You can access the course for only $13 by going to nurseeunice.com and make sure that you enter the promo code SPRING 2024 whenever you are registering for the course. So since I failed the first time, let me retake this test, and I'm retaking it with you all. Again, if you see me looking down, it is because I am checking your answers on my phone. All right, so everybody, number one. What is the primary purpose of patient education by nursing assistants? Is it to impress the healthcare team, to showcase the nursing assistant's knowledge, to replace the role of the nurse, or to empower patients to participate in their care? Victoria, it says only one attempt, but excuse me, two attempts, but I'll make sure I change that so you can have unlimited attempts. Good morning, Anna. I see D. All right, all right. So everybody, we're going to choose D for the first response. Let's go to the next one. How should a nursing assistant communicate with a patient who has a hearing impairment? Use written communication, speak loudly and slowly, speak from a distance, or avoid eye contact. There we go. It's back. All right. So how do we want to do this? How should we help somebody who has a hearing impairment? Use written communication, speak loudly and slowly, speak from a distance, or avoid eye contact. I see two A's. I see two D's. Anyone else? Josie, can you see them now? All right, looks like A or B has it. So I have more A's. We're going to use A. All right, number 3. Which chronic illness often requires dietary restrictions related to fluid intake? Try to make it bigger for you. I hope that's better. All right, so which chronic illness often requires dietary restrictions related to fluid intake? Is it Alzheimer's disease, rheumatoid arthritis, chronic obstructive pulmonary disease or COPD, or congestive heart failure? You're welcome, Josie. Oh, looks like everyone is choosing D. Our next question: why is it essential to confirm patient understanding during communication? The first response: it undermines the caregiver's authority. To prevent misunderstandings and ensure clarity, patients always understand information correctly, or it wastes time. Why is it essential to confirm the patient understanding? Why do you repeat things back to them and then ask them questions about what you said? All right, overwhelming response is B as in boy. What is the initial step in responding to a cardiac arrest situation? Positioning the patient in a supine position, calling for emergency medical assistance, administering CPR or cardiopulmonary resuscitation, or checking for a pulse. You're responding to a cardiac arrest situation. I have C, I have D, I have B, I have C. And let's see. Cardiac arrest. The heart has stopped. How do you respond? Oh, you all are torn between C, D, and B. All right, I'm getting more B's, so I'm gonna choose B. When assisting a resident with ambulation, what should the nursing assistant check for first? The resident's mood, walking cane, ambulation belt, or proper footwear. You are assisting someone with ambulation. Which of these is your priority? I see D. All right, so Anna says D, Anide says D, Kendall says D. So everyone, we're going to choose D for this one. All right, now next one. We chose D for the last one, everybody. Next, what should a caregiver do if a patient is visibly distressed during a conversation? Tell the patient to calm down, conclude the conversation quickly, ignore the distress and continue talking, or express empathy and address the distress. Your patient is visibly distressed, they're upset. Oh, this one was easy for you all. When I looked down, you all had the answer. You chose the last one, D. Next, when providing perineal care to a resident, which action should the nursing assistant prioritize for infection control? Rush through the process to save time, use the same washcloth for the face and perineal area, wipe from back to front, or change gloves between tasks. Let's see. Christy, Estelle, Paula, Karen, Anide. Not sure if my screen is updating here. All right, so if I don't have any new responses in about 3 seconds, I'll go ahead and click a response. Who knows, maybe you have a commercial break right now. All right, so we're going to go ahead and choose this last one. Which of the following is a common symptom of malnutrition in chronically ill patients? Dry skin, weight gain, increased energy levels, or muscle wasting? There we go. Now we're getting some new answers coming through. All right. Looks like everybody says D. How often should a nursing assistant encourage a resident to perform deep breathing exercises to prevent respiratory complications? Every 4 hours, every 6 hours, every 2 hours, or once a day? So for this one, think of a patient who maybe, had surgery or who's in the facility who's at risk of developing lung issues or respiratory complications such as pneumonia. How often do you want to encourage them to take deep breaths in and out? All right, I'm not sure if there's a delay, but I'm not seeing answers here. So let me go back over here. All right, now I see some answers. Let's see. All right, most of you all said C. So we're going to choose C. All right, next, which action is a violation of patient confidentiality by a nursing assistant? Which action is a violation of patient confidentiality by a nursing assistant? Discussing patient information with a colleague, all of the above, which should be last, posting patient details on social media, or sharing patient information with family members. Which of these are violations of patient confidentiality? Let me go over here. Let's see what you all have. Oh, B's, great job. All of the above. A client with hypertension should avoid which of the following dietary components? Hypertension, high blood pressure. What should they avoid? Low sugar diet, high sodium diet, high carbohydrate diet, or low fat diet? Yes. All right. Most of y'all have B, so we're going to select B. Which vital sign is measured by the nursing assistant? This is easy. Oxygen, blood pressure, all of the above, or the respiratory rate? Oh, you all are everywhere. I see B, A, C, B, A. I'm seeing everything. So, should I go with C or should I go with B? All right, Dave says C a night. All right, so we're getting a lot of C's. So for this one, we'll choose C, all of the above. When assisting a client with eating, the nursing assistant should prioritize feeding the client before providing personal care, feeding the client in a reclined position, encouraging independence and self feeding, feeding the client quickly to save time. Let's see. Vivian says C, Janelle says C, Anna says C, the Miller fam says C. So we're going to go with this one. What is the purpose of using gown and gloves when providing care to a resident on contact precautions? Is it to keep the resident warm, to protect the nursing assistant from infection, to prevent the spread of infection to others, or to improve residents' comfort? All right, so I think I said Chrissy said C. We have so many C's. Miller family, Victoria, Dave's, Edna, Paula. All right, so everyone for this one, we're choosing C. Which task is within the scope of practice for a nursing assistant? Administering intravenous medications, assisting with feeding, interpreting diagnostic tests, or changing sterile dressings? Which are you allowed to do as a nursing assistant? So many B's. Great job. What role does body language play in patient communication? It can contradict or reinforce verbal messages. It only matters in emergency situations. It has no impact on communications. Patients don't pay attention to body language. Let's see. Janelle says A. Anna says A. I think Karen may have said B. Estelle says B or A, excuse me. So let me just see what the overwhelming response is. Looks like the overwhelming response is A. So that's what we're going to choose. It can contradict or reinforce verbal messages. What is the correct technique for providing oral care to a resident who is unconscious? Is it use a fluoride toothpaste, perform oral care every 2 hours, avoid brushing the teeth, or brush the teeth once a day? Cleo says D. Victoria says B. Anide says B. Anna says B. So we're going to go with B. Looks like we have a lot of B's. Infection control is a crucial aspect of a nursing assistant's role. Which action promotes infection control? Changing bed linens weekly, washing hands regularly, wearing gloves only during certain tasks, or reusing disposable masks? Let us see. All right, we're going to choose B. What is the purpose of using a draw sheet when repositioning a patient in bed? Is it to limit the patient's movement, to immobilize the patient, to reduce the risk of skin shearing, or to increase friction during movement? What is the purpose of using a draw sheet when you reposition someone? Janelle says C. Miller fam says C. Anna says C. Anything? Looks like Chrissy says C. So we're going to choose C for this one. Ooh, which food item is high in omega-3 fatty acids, beneficial for cardiovascular health? Is it nuts, avocado, salmon, or olive oil? Right. Chrissy says C. Karen says B. Cleo says C. Anna says C. And Nide says B. So we're torn between B and C. Let's see 2 more responses and we'll choose. All right. So most people said C. So we're going to choose C. We're going to say that salmon is high in omega-3 fatty acids. How should the nursing assistant respond to a resident who is refusing to take medication? And for this one, I want you to think of a CNA who has maybe taken a state approved medication assistant course, or if you're in some of the ALFs, they will usually have you take a med tech course. So a basic CNA cannot pass meds, but those who've had additional training sometimes can, depending on state laws. So keep that in mind when we answer this question. So how should a nursing assistant respond to a resident who is refusing to take medication? Insist that the resident takes the medication, report the refusal to the nurse, leave the medication at the bedside for later, crush the medication and mix it with food. What do you do? All right, everyone says B. Victoria, Viv, Lynn, Butler, Karen, Josie. So we're going to choose B. When assisting a patient with mobility, what is the correct technique for using a transfer belt? Do you place it above the elbows, place it over the patient's chest, place it around the patient's neck, or place it around the patient's waist? Where do you place the transfer belt? What's the correct technique? All right, a lot of B's for that one. Oh, let me go back. B's, D's. Oh, we have more D's. There we go. Why is potassium restriction important for patients with renal issues? Is it to manage blood pressure, to avoid hyperkalemia, to promote weight loss, or to prevent dehydration? Why is potassium restriction important for patients with renal or kidney issues? So as a CNA, you also have to be mindful of the client's dietary needs. So why do we restrict potassium in those who have kidney failure? Looks like everyone is saying B mostly. And then we have a D and we have an A, but then we're back to B. So let me just go back and check. B, D, A, B, D, A. Oh my. I don't know which one to choose. All right. So I'm probably going to choose. Oh, you all are everywhere. So I don't know what to choose. I'm just gonna close my eyes and pick. And who's ever on I pick is the one that we're going to choose. All right, the Ann family says A, so we're gonna go with A. What is the purpose of restraints in patient care? Is it to punish the patient, to restrict mobility for staff convenience, to maintain patient independence, or to prevent falls? And I don't like any of these answers. All right, Cleo says D. Hernia says D. Anna says D. Felix says D. I'm going to choose D only because that's the responses that I was provided. In which situation should a nursing assistant use personal protective equipment or PPE? Assisting with oral care, providing wound care, changing bed linens, or all of the above? When do you use PPE? All right, we have some D's, we have some B's. Looks like we have a lot of B's. So for this one, we're going to go with B. And every time you take this test, not only are the questions arranged differently, but also the answer options are arranged differently. So you should never get the same test twice. And so for those of you all who are just tuning in, we're on my personal online CNA exam prep course, and we're doing one of the practice examinations, and you would access the course by going to nurseeunice.com. And if you want the discounted course for $13, you would enter the promo code SPRING 2024. All right, so what is the primary purpose of using a draw sheet? Well, we answered this one, I think. What is the primary purpose of using a draw sheet when turning or repositioning a resident in bed? To maintain proper body alignment, to keep the resident warm, to assist with sliding the resident, to provide additional cushioning. All right, we have A's. We have A's. Victoria says C. I'm going to go back and check again. All right, we have a lot of A's and we have a lot of C's. Oh, now we have a B. So I'm going to do like I did last time. I'm just going to close my eyes and I'm going to pick one. All right, Viva says A. So that's what we're going to choose. How can a caregiver effectively handle a language barrier in communication? Use simple medical terms, speak louder, and use hand gestures. Provide written instructions in English. Avoid communication until an interpreter is available. How do you manage a patient who speaks a different language than you? All right, we have A, we have B, we have C. Let me go back again. How can a caregiver effectively handle a language barrier in communication? Do you use simple medical terms? Do you speak louder and use hand gestures? Do you provide written instructions in English, or do you avoid communication until an interpreter is available? Let's see, let's see, let's see. Oh, you all, again, you're everywhere. I'm closing my eyes. I'm just going to select one. All right. Amita says C. So we're going to choose C. Let me hide that. What should be monitored in patients with liver disease regarding their diet? Is it sodium, protein, calcium, or iron? If we're monitoring it, that means that too much of it must be a bad thing. So, which are we monitoring for in those who have liver failure or liver disease, such as hepatitis or cirrhosis? Bougie, why you put your phone number in there? We don't know what that's for. Janelle, Anna, Felix, everyone is saying A. So we're going to go at the first one, A. When performing CPR on an adult, what is the compression to ventilation ratio? Is it 10 compressions to 1 ventilation, 5 compressions to 1 ventilation, 15 compressions to 2 ventilations, or 30 compressions to 2 ventilations? All right, I'm going to check to see what you have. Oh, everyone's pretty much choosing D. So we're going to go with D. All right, so for this one, why is fiber important for patients with digestive disorders? It helps regulate bowel movements. It reduces fluid intake. It promotes weight loss. It increases sodium levels. Why is fiber important? All right, looks like we have a lot of A's. We may have had some D's too. All right, so A. All right, so I think that we can go with A for this one. There are more A's than any other option. All right, so what should the nursing assistant do if a patient complains of chest pain? Ignore that where it says administer pain medication. That's a mistake. Do you want to administer pain medication, encourage the resident to rest? Do you notify the nurse immediately, or do you apply a heating pad to the chest? Your patient says that their chest hurts. What do you do? Yes, everybody. We're going to notify the nurse immediately, and you stay with the resident in case they go into cardiac arrest. Right? When caring for a resident with a catheter, what is essential for preventing urinary tract infections? Use soap and water to clean the catheter, change the catheter weekly, keep the drainage bag below the level of the bladder, or empty the drainage bag once a day. This one is hard for me because I want to choose one of two options. Let me see what you all think it is. Oh, everyone chose C. All right, so we're going to go with C. What does ADL stand for in the context of nursing assistant duties? Is it activities of daily living, assisted diagnostic learning, advanced daily living, or acute disease level? All right, Chrissy says A. The Miller fam says A. Edna says C. All right, Viva says A. Felix says A. We're going with A, everybody. Activities of daily living. How can a caregiver adapt communication for a patient with a hearing impairment? Do you want to use complex medical terminology, speak louder, avoid facing the patient directly, or use written communication? Your patient has a hearing impairment. How do you communicate with them? So Hernia says D, Janelle says D, Anaya says D, Felix says D, Paula says D. So there it is. D is our response. And we're going to do probably, we'll do 50 today. So we have about 15 questions left to answer. And then we'll show you the answers and our score. Our score, of course, will not be a passing score because we're not going to complete all 100 questions during this video. What is the appropriate response if a resident begins to choke during a meal? Continue with the meal and monitor closely. Leave the room and call for help. Encourage the resident to drink more water. Perform the Heimlich maneuver. The resident begins to choke during the meal. What should be the CNA's response? Doing my nurse happy dance. All right, everyone's going to do the Heimlich maneuver. Thank you for not giving her water. How can a caregiver show empathy during communication? Demonstrate understanding and compassion. Minimize the time spent with each patient. Keep conversations strictly professional, or avoid eye contact to respect privacy. I want to show empathy when I'm communicating with a resident. What do I need to do? All right, so many A's there. Good job. Which of the following vital signs is measured using A stethoscope and a sphygmomanometer. Sphygmomanometer. Is it the heart rate, respiratory rate, blood pressure, or temperature? And repeat it after me. Sphygmomanometer. All right, we have A's, we have B's, we have C's. Oh, you all are everywhere. We have a B. We have a lot of C's. So we're going to go with C. What is the first step in hand washing for infection control? Dry hands with a paper towel, use hand sanitizer, use soap and water, or use cold water. What's the first step in hand washing if you're trying to prevent infections? Okay, a lot of C's for this one. When providing perineal care to a female patient, what is the correct wiping direction? Front to back to front, downward motion, upward motion. When you're cleaning a female's private area, how do you wipe? We see A's, we see C's. Oh, A's have it front to back. Which of the following interventions is essential for preventing pressure ulcers in bedridden clients? Using sheepskin pads on the bed surface, frequent repositioning, applying heat packs to pressure points, or massaging bony prominences. Let's repeat that. Which of the following interventions is essential for preventing pressure sores? Using sheepskin pads on the bed surface, frequent repositioning, applying heating pads to pressure points, or massaging bony prominences. Oh, a lot of B's. B, 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 B. Frequent repositioning. What type of fat should be limited in the diet of patients with hyperlipidemia? So even if you don't know what lipidemia is, the fact that it says hyper means that they have too much of it. So should they have a diet that limits omega-3 fatty acids, polyunsaturated fat, monounsaturated fat, or saturated fat? In other words, which one of these fats is bad? Which is the bad fat? All right, we have two B's. We have a lot of B's. We have D's. We have B's. All right, let's see. Next two answers will decide. Next two will decide. Dave's was last. I need two more responses. Shasha and Estelle said D, so we're going with D. What is a potential concern for patients with chronic obstructive pulmonary disease, or COPD, that should be considered in their diet? Is it high calorie intake, low sodium intake, weight loss, or adequate protein intake? We have somebody who has a respiratory concern. So what is their dietary concern? High calorie, low sodium, weight loss, or adequate protein intake? And I'm going to tell you now, I don't know the answer to this one. All right, so everyone's saying D, so I'm going with the group. It is D. Why is it crucial to document patient communication accurately? Documentation only applies to medical procedures. It's unnecessary in healthcare settings. Patients don't review their medical records. It aids in the continuity of care and provides legal protection. Why must you document accurately? Perfect. We're selecting D. All right, we have about 5 questions left, or 6 questions left before we actually reveal your answers. All right, so for this one, why is it important to address a patient by their preferred name or title? Using titles is unnecessary in healthcare. It saves time during communication. It doesn't matter as long as the caregiver is respectful. It personalizes the care experience and shows respect. Everyone should have this one. That was way too easy. Good. I'm excited to see what your final scores are. All right, question number 40, I think 46. Which statement demonstrates cultural competence in the nursing assistant's role? I should be aware of and respect the patient's cultural beliefs and practices. I will provide care based solely on medical needs, regardless of cultural differences. I don't need to know about the patient's cultural background. It doesn't affect care. Or cultural competence is only necessary for healthcare professionals, not nursing assistants. Cultural competence. We have A's, we have B's, but overwhelmingly we have A's. 47. When is the best time to educate a patient about their care plan? When the patient's feeling overwhelmed, when the caregiver has limited time, only at the beginning of their hospital stay, after a medical procedure. This one's hard. I don't like these. Change this question. When is the best time to educate a patient about their care plan? All right. I don't like this one, so I think it's just best to choose. All right, so most of you all chose A, and I'm going to go with my students. I'm going to go with my CNAs. Um, you all say when the patient's feeling overwhelmed. We have A's, we have C's. Oh my, we have a lot of C's too. All right, I don't like this one. We'll see what the computer says. We'll go with C, and I'll change that question. 47, what is the role of a nursing assistant during the admission of a patient? Diagnosing a patient's condition, performing a complete physical examination, assisting with the admission paperwork, or documenting the patient's medical history. Just got a patient to the unit. You have a job. What is your job? Have a lot of C's. All right, you're going to assist with the admission paperwork. Yeah, you have vital signs. You have to do their you actually have to document their belongings. So yes, you have paperwork too. Which of the following is a common sign of a myocardial infarction, aka heart attack? Diaphoresis, hypoglycemia, hypotension, or bradypnea, which is slow breathing. Someone's having a heart attack. Lots of D's. Lots of D's. So we're going to go with D. What is the correct sequence for the steps in hand washing? Rinse, apply soap, wet hands, and dry. Dry hands, apply soap and rinse. Apply soap, rinse, and dry. Wet hands, apply soap, rinse, and dry. What is the correct step? All right, everyone said D. So what we're going to do, everybody, is looks like we still have 49 questions to answer, or we'll go ahead and answer this one. Which dietary modification is recommended for a client with chronic kidney disease? Is it low phosphorus diet, high potassium diet, high protein diet, or high sodium diet? Remember, when someone has kidney disease, the kidneys cannot excrete the toxins. And so things that if a normal person actually ingested them, it would be okay. But if a person with kidney disease ingests too much of anything, it causes their body to become toxic, and it can cause their heart to stop. So what do you think the best response is? All right, looks like we have a lot of D's. Good morning, Anthea. All right, let's finish and review. All right, so it's letting us go back and look at our responses. And if we don't like a response, we can go ahead and go back and change it. It's also letting us know that we didn't answer over, 40 some odd questions. We answered 51 out of 100 questions. We're going to submit it. Fingers are crossed. And of course, we knew we were going to fail because we didn't even answer all of the questions. But let's go through. Number one, what's the primary purpose of patient education? We chose B, to empower patients to participate in their care. That was correct. And there's the rationale. Let's go find one that we did not answer correctly. Oh, you all did an excellent job. You answered all of these correctly. All right, so here's one. Number 12, a client with hypertension should avoid which of the following dietary components? Um, and I think you are absolutely correct. Correct answer was B. That's not right. You all were right. So I need to fix that because if they have hypertension, they should avoid a high sodium diet. So my assistant put in the wrong answer as the correct answer, but you got that one right. That is not wrong. Let's keep going. Oh, wow. You all should be so proud of yourselves. You got nearly every answer correct, minus my goof up. All right. So, why is potassium restriction important for patients with renal issues? We chose to manage blood pressure, but here's a new term that I need you to know. It's actually C, to manage hyperkalemia. So, hyperkalemia is an increase in potassium. So, hyper, too much, kalemia, referring to potassium in the bloodstream. So, patients with renal issues may have difficulty excreting potassium, leading to elevated levels and potential complications. So, if you have time, what I want you to look up is which foods are high in potassium. Because if you ever have a renal patient and they have bananas and orange juice and some other high potassium rich items on their plate, that means that they have the wrong tray and you need to notify the nurse immediately. All right, looks like we also answered number 26 incorrectly. It says, in which situation should a nursing assistant use personal protective equipment? And the correct response was, uh-uh. Oh, I'm embarrassing myself. You all chose the correct response. So you got that one right too. It's not C. It is going to be all of the above. You want to wear gloves when you're providing oral care, when you're changing bed linens, and when you're providing wound care. All right, let's see this one. This one, what is the primary purpose of using a draw sheet when turning and repositioning a resident in bed? Looks like we chose to maintain proper body alignment, but the correct response, and this one we were debating about, was it D or was it C? So those who chose C, you are correct. We're using a draw sheet to assist with sliding the resident. So you actually put a folded sheet beneath the resident. It takes a team of two, and one caregiver on either side will lift up the draw sheet, what lifts up the patient, and then we move them up in bed. So a draw sheet helps in sliding the resident more easily during the turning and repositioning, while also maintaining proper body alignment. All right, the next one we answered incorrectly was number 28. How can a caregiver effectively handle a language barrier in communication? Some of you all provide written instructions in English, but if they don't speak English, whether you say it or you write it, they still don't understand that language. So the best response out of these options would be C. You want to use simple medical terms. And also you can see if there's another nurse or CNA in the facility who speaks that person language, and they can actually interpret and help build the bridge, help with the language, the communication. All right, 29, we didn't answer correctly. What should be monitored in patients with liver disease regarding their diet? And I know this one was tricky. We chose sodium intake, but the answer is actually B. When someone has liver disease, they can't break down protein, so they should not have a high protein diet. So, liver disease, limit proteins. Monitoring protein intake is important to manage complications and to maintain liver function in patients with liver disease. It's too much work, they cannot break it down. Oh, you all did so well. So I think total out of the ones that we answered, you all only missed, I want to say four, because two of them were my mistake. All right, so 43. What is a potential concern for patients with chronic obstructive pulmonary disease that should be considered in their diet? And we chose we chose C, adequate protein intake, but the correct response is D, weight loss. COPD patients may experience weight loss due to the increased energy expenditure and difficulty in eating. Remember, they're having a hard time breathing, so eating their meal would not be their priority. And COPD is a chronic disease. It's a chronic illness. So that means that they usually have this condition longer than 6 months. All right, 47. What is the best time, or excuse me, when is the best time to educate a patient about their care plan? And some of you all did say B. So we chose A, but for those of you all who chose B, it says educating patients when they are receptive and not overwhelmed promotes better understanding. So the question was not worded the best, but if you chose B, you knew that the patient needed more assistance during that time. And then here's our last one, 49. Which of the following is a common sign of myocardial infarction? And for this one, it's actually C. So whenever someone's having a heart attack, they become sweaty. They become diaphoretic, also referred to as diaphoresis. And that is a common symptom of myocardial infarction due to the body's physiological response to stress and decreased cardiac output. So, team, I am so proud of you. You all did such a great job. So, I look forward to seeing you all in the next video. I have a business consulting class today at 2, so I don't think I'm going to be back over here on here until the weekend. Happy Mother's Day for my mothers. Happy Nurses Week for my CNAs and my nurses. And I will see you all in the next video. Again, go to nurseeunice.com, and you can always we have free resources on there. We do have some resources that cost about $5, but if you want to actually access this site, let me just go back to the site, because there are multiple tests. Oh, forget the fact that it says failed, because we're not failures. We just didn't complete the entire thing. There are so many resources on here for you to actually take your test, for you to study, and it even helps you with choosing your state, so that you know how to register for your test. So again, this is Nurse Eunice with Florida Training Academy, and I'll see you all in the next video. Bye, everybody.